Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everybody, welcome again to Ziada Academy. And today we'll talk about the third cause of painless red eye. I have shown in the previous lectures the first cause, which is the subconjunctival hemorrhage, and how to differentiate it from the other causes. And the second one is episcleritis and how to differentiate it from the subconjunctival hemorrhage as well as from the scleritis. And the tests which could differentiate between the scleritis and episcleritis. Today I will talk about one of the most common causes of painless red eye, which is the conjunctivitis. The conjunctiva is either palpebral and tarsal conjunctiva. Bulbar and tarsal. Also, the tarsal could be named palpebral conjunctiva. So the bulbar and tarsal conjunctiva, and in between the bulbar and tarsal, there is fornicial conjunctiva, which fills the fornices, which are the upper fornix and the lower fornix, which are the sacs of the conjunctiva between the tarsal and bulbar conjunctiva. Bulbar conjunctiva is a part which covers the exposed part of the eye, covers the sclera and all around the cornea, and the tarsal is the part of conjunctiva which lines the back of the upper and lower lids. So the conjunctivitis could be bulbar and tarsal conjunctivitis. And about the causes, the conjunctivitis could be infective or allergic. The infective also may be bacterial or viral. Allergic may be seasonal allergy or allergy to drug use or contact to any irritant factor. So the common presentation and features of the conjunctivitis is general discomfort, watering, and grittiness, with variable amounts of and colors of discharge. Maybe mucoid discharge, white or creamy white, or mucopurulent discharge, like greenish or yellowish discharge, or the purulent discharge, which is like milk white, like the pus. It's typical for the eyelids to be crusted with the dried discharge and maybe shot together in the morning by the sticky discharge, with diffuse conjunctival injection, possibly with chemotic conjunctiva, swollen conjunctiva is called chemosis, especially in the moderate and severe cases of conjunctivitis, and debris, which is remnants of discharge elsewhere inside and outside of the eye. The majority of cases can be diagnosed on clinical features by the common presentation and leading signs. But the swab, to take swab from the conjunctival sacs to be examined by the smear, also by the other lab tests to know the pathogen, could be helpful if symptoms persist in spite of treatment, or if you suspect chlamydial or gonococcal infection. Let's go to one of the common causes of infective conjunctivitis is the viral conjunctivitis. Especially the common presentation after having cold or influenza, you may find that the eye is angry, injected, and watery. So you suspect viral conjunctivitis associating the cold or the influenza, or infection with the adenovirus. Also, the other causes of the other viruses, like the cold or influenza viruses, could be a cause for viral conjunctivitis. Extremely contagious, so take care. You have to wash your hands thoroughly, you and the patients. The eye watering, cortisol or flow symptoms with pre-auricular lymphadenopathy, It may result in corneal inflammation and buildup of debris, especially with adenovirus. It's called adenoviral punctate punctate keratitis or epithelial keratitis. Management is usually conservative with lubricants and non-inflammatory, non-steroidal anti-inflammatory drugs if needed, and cold compresses can provide symptomatic relief. Actually, antibiotics with no role, so they are not helpful in such cases. So don't prescribe antibiotics at all in such cases. Advise patients that these symptoms may take days to weeks to resolve spontaneously, and the patient should wash their hands regularly and not share towels with others or the other self staff. The hygienic protocols should be followed during these infections. Let's go to the other cause of infective keratitis, which is the bacterial keratitis. Bacterial keratitis, bacterial conjunctivitis may be caused by different kinds of pathogens. But actually, they are less common than the viral conjunctivitis, but I'm talking about the developed countries, but the developing and promiscuous countries, the bacterial conjunctivitis could be more common than the viral conjunctivitis. They are caused by the same pathogens as respiratory infections by pneumococcus, by staphylococcus, haemophilus influenza. They are most commonly known pathogens for the bacterial conjunctivitis. Often has more extensive conjunctival injection and discharge compared to viral conjunctivitis, profuse infection or deep infection. Management involves the management of the bacterial keratitis, bacterial conjunctivitis is different than with viral. The viral was conservative and symptomatic relieving measures, but here the management involves the application of topical antibiotics such chloramphenicol, drug of choice, broad spectrum, eye drops or eye ions with fusidic acid eye drops or eye drops again. This is one of the endemic diseases in Egypt, which is the chlamydial conjunctivitis, and which is related to the chlamydial group, which is known as trachoma, Chlamydia trachomatis. Relatively difficult to differentiate it from the other causes of bacterial conjunctivitis, but you have to suspect in younger age groups with risk factors. Typically persistent one-eyed conjunctivitis with serous discharge, diagnosed by rough swabbing and PCR. Requires systemic antibiotic treatment as for genital chlamydial infection. I'm talking about the chlamydial conjunctivitis, not the trachoma itself, because it starts as a conjunctivitis like the others, and may end after that with the passing of the cycle of this disease to be trachoma with its sequelae. Refer to genitourinary medicine because this chlamydial infection may affect the genital tract and may be associated with conjunctival infections, so you have to check for the genitourinary tract infection. So the treatment will include both of them together, the genitourinary tract and the eye infection at the same time. May cause significant scarring if untreated, and reinfection is common with the sequelae of the Chlamydia trachomatis infection. Here, the most severe and important or risky type of conjunctivitis with gonorrhoeal conjunctivitis. Again, suspect in younger age groups with risk factors. It's also related to the genitourinary tract infection, severe swelling, and hyperpurulent discharge, which may look like pre-septal cellulitis. It's severe with swollen conjunctiva, swollen eyelids, profuse discharge, as you see in the pictures, in the upper and the middle pictures, like purulent, profuse, which is not viscous, which is not sticky, like the mucopurulent, especially with if associated with genitourinary tract infection. So refer to genitourinary medicine service for evaluation of the genital disease and contact tracing. Treats systemically with antibiotics. Sequelae can be very significant. Gonorrhea can cause corneal ulceration and scarring, as you see in the most lower picture. So you have to treat it aggressively to avoid the corneal complications which may happen after this infection. In the chlamydial infection, I will consider the azithromycin orally and topically. In the gonorrhoeal, I will give the drug of choice. Cases of conjunctival, of gonorrhoeal conjunctivitis is azithromycin, doxycycline, or erythromycin, which are taken by mouth. Also, we can use topical azithromycin eye drops. Also, we can use a single injection of ceftriaxone in severe cases of gonococcal conjunctivitis. Conjunctivitis of the newborn is prevented by routinely given silver nitrates eye drops. It's not available in the market today, or erythromycin ointment to all infants at birth, especially if it's known that their mothers have a gonococcal infection or any genitourinary tract infections with such organisms. I hope I could cover the important points about the conjunctivitis. The conjunctivitis, which is viral or bacterial conjunctivitis. The bacterial could be the mucopurulent conjunctivitis or chlamydial conjunctivitis or gonorrhoeal conjunctivitis. Thanks so much, and see you in the coming video about the viral conjunctivitis, which is one of the causes of painless red eye. Assalamu alaikum wa rahmatullahi wa barakatuh.